the big thing is going to be what we call interoperability, and what that means is that if wherever you touch the healthcare system, the information generated by that encounter should be available to any other place you might ever touch the healthcare system. And right now, it's all siloed within, except where there are health information exchanges, it's all siloed within individual health records. And they don't talk to each other. Even though and the technology for that isn't quite there either. It's not that we can't write interfaces to do that, but then, if I've been seen by 5 or 10, 15 different providers in different places, and how is that information made available to the next place I come in without looking at all these different places for it, or dumping all the information into one place for and call that a health information exchange? The latter is what we've done. It's taken us since 1987 to get where we are. It's cost many tens of millions of dollars, and it's being underutilized at this point. So that may not be the answer. A better answer would be to write a platform to create a platform that all of the electronic medical record systems have to talk to. And then once you have that, then all the other things that might happen through using the electronic medical record data can be an app. So like your iPhone. Your iPhone is one of these platforms. And I can go into Google and I can Google you, and all sorts of stuff shows up about you. And it doesn't matter that might be in 150 different places. Okay? That information shows up about you. And so why shouldn't I be able to Google your blood sugars or your blood pressures, and I see them all? It doesn't matter where they all are. All we need is an index showing where you have that information and to be able to go out and pull it. And we know we can do that because that's what Google does now. So and I'm not terribly concerned about the security part of this because the technology for that is there, and when used appropriately is as secure as it's ever going to be. I mean, most of the time when there are breaches is because some human being did something wrong, not some computer did something wrong. Once we have this universal platform, then systems talking to each other becomes relatively easy. And there is a group now working on that platform. It's 5 or 10 years away, but it's something that will then obviate the need for health information exchange because you don't need a central database. You can go out and get the information you want from wherever that information is. Now, we don't have in this country a universal identifier. You can say social security number. You can say my SSN is my identifier, and it could serve that way. But there are a lot of sensitivities to using that as an identifier because it can use this for identity theft and other things. So how do we know that this record in this hospital system and this record in this hospital system are both you? And that's a lot harder than you think, because sometimes they may spell your name wrong because it's just somebody typing information into the system. They could use your middle initial versus middle name versus leaving it out. You might change addresses so they think it's a different person. You could get married and change your name. So almost any electronic health record system has 10 to 20% duplication in it, because people just come in at different time unconscious, and the information is stored differently, for whatever reason. Being able to say this is just me is a problem. So you're going to have the same problem when, for example, if you Google your name, you get people with that name who aren't you, right? So how do you prevent that from happening in healthcare? If I want to Google your blood sugars, how do I know that your blood sugars? That's not easy. And we're going to have to come up with some kind of universal identifier. Now, if I had my druthers, it would be this. Scan my fingers, that's who I am. And do that every time I come in, and then that's stored as a file. Those are just data points. Those data points are stored as a file, and that identifies that record for me. So we know who that person is. That's one of the things we have to solve.